Hello and welcome to the EduTalk series hosted by Biotone EduPartner Program, and massage industry experts. With the growing interest and popularity of the EduTalk series, Biotone continues to support virtual learning and building massage community by connecting you with industry experts who share their knowledge and expertise on topics not only for class discussion, but career success. Today's expert is Dale Alexander, a PhD and LMT who has specialized in resolving chronic somatic problems since 1980. He's author of The Inside Out Paradigm and published over 100 articles for Massage Today. Dale was selected as 2016 CE Provider of the Year by the Alliance for Massage Therapy Education and is a 2023 inductee into the Massage Hall of Fame run by World Massage Festival. Let's listen and learn as Dale discusses and presents freeing the heart by releasing the body's central linkage. A new view of the body from the inside out. He'll describe how this perceptual shift assists clients to regain quality of life, and he'll describe how the heart and lung complex needs ongoing delivery of raw materials to produce re-nourished blood to feed and vitalize cells by reducing obstacles to the venous and lymphatic returns. Dale has a lot to get to tonight. I'm going to turn it over to you, Dale. I'll exit the screen. I'll see you on the other side. It's all yours. And again, everyone, if you could please be sure your video is off and your sound is muted, that would be perfect. And we'll see you later. Thanks.
Thanks, Danielle. And let us all thank Biotone for continuing to produce this series and allow me to welcome each and every one of you. Over my 45 years of working with chronic somatic difficulties, inspiration has been my muse, discovery, my delight, and seeking daily satisfaction has been how I've kept my mind open and fresh to new ideas. Tonight, we're going to tiptoe through the treetops of all the concepts that have shown themselves to be useful in freeing the heart. John Upledger is first on this list of acknowledging teachers because his courage and creativity transformed the manual therapy professions. His personality brought next to him exceptional osteopathic physicians that had knowledge of the visceral anatomy in an unparalleled way, Dr. Vagal, and joint mechanics, Dr. Richard McDonald. For 7 years, I applied myself there, writing with Dr. McDonald the first workbook for the muscle energy technique courses, and then taught them for 5 years. Over the ensuing decades, clients became my finest teachers of the aging process. Until you know something is possible, you don't. We all use models of anatomy, how things are organized and how they function. The inside out paradigm basically expands these parameters beyond the traditional ways of thinking. Tonight, we're going to speak to how organs actually affect joints and then assert that the evolutionary role of the soft tissues is to protect the joints, and also to prevent fractures if that's possible. Think of it in a very simple way. The viscera hang from bones and either directly or indirectly may shift them in terms of their capsules. That itty bitty shift, or sometimes a major shift, then provokes the lockdown of the soft tissues. It's a simple model, but it has very long lasting results. And sometimes you get to participate in a miracle. In 1996, I was looking for a simple model that would demonstrate how the visceral organs affect the joints and structural integrity. And I recognized, the answer was staring me in the face, of course, in the anatomy, that our major organs are encased in sacs, whereas the other organs are composed of tubes, both tubes within them and those that connect them. In response to stress or trauma, the sacs cringe and the tubes simply shorten, narrow, and sometimes twist. The visceral organs are our first responders to stress, and they tend to hold the echoes of trauma the longest. What speeds the aging process and slows the recovery from injury and illness is there is not enough re-nourished blood reaching the tissues that need it the most. Malnourished tissues and lack of oxygen are drivers of ischemic pain. Over 100 years ago, medicine discovered that the heart can really only pump out the volume of what it gets back. So one of our primary jobs is enhancing the volume, rate, and direction of the venous and lymphatic return back to the heart-lung complex. This has relevance as 1 in 5 of us are going to leave this earth due to heart disease. In the early 2000s, I had a wave of people coming to me with congestive heart failure. This is what I know the most about and have had the most success with. Sam was the first, and he was further down or along the progression of the disease and passed away. But his spirit was indomitable, and I was very inspired, and everything I've learned since I credit to him. I received a call from another gentleman by the name of Glenn, who excitedly had just gotten off the phone with his cardiologist, and they were sharing with him that his left ventricular enlargement had lessened by a third. I've had 4 other individuals and their cardiologists say the same thing. And then came along Elliot. Elliot was, I call him Farmer Green Jeans, big tall guy. He came in with a right bum shoulder, and almost as an afterthought said, "You know, my doctor has told me to get my affairs in order." And I said, "Why?" And he said, "Because my ejection fraction is 12. I said, "I don't think I've ever heard of it being that low." And I looked at him and said, "Do you want to do your best to see if we can make life better for you?" And he said, "I didn't think that was possible." I said, "I don't know that it is either." And that's the point of both of these elements here. I didn't know that ventricular hypertrophy could be influenced or that someone's ejection fraction could. It was a discovery that has happened enough times that I present it to you now. Consider how our profession might be viewed with patients reporting increased energy and less daily edema. We can help. My thanks to Michael Shea for sharing this with me. So often associated with courage, loyalty, and love, the heart is truly a source of wonder and awe. Its 100,000 contractions a day provides nutrients, picks up the garbage, and protects us internally from foreign invaders. The bioelectric impulse, the PQRST wave, flowing across this majestic organ adds to its steadfastness in facilitating our quality of life. What the heart and lungs need most is space, space to expand. Here we see the heart directly on top of the liver. And my cursor will come back soon. There it is. And this is the liver. Directly beneath it, not seen, is the diaphragm. We will refer to this as the body's Oreo cookie. It is a cornerstone to how we may assist our clients. And please understand, folks, these are conceptual models, and no model is ever complete, even this one. Humility is a cornerstone to empirical science. So repeating, our number one job is the heart and lungs need space to expand. When the lungs expand, it allows the alveoli to vent more CO2 and absorb more oxygen. With the heart's expansion improved, it gathers and expels more blood with greater force. Fresh blood delivers oxygen, nutrients, and hormones, removes waste, and its smooth flow is the essence of healthy immune function. With a bit of knowledge, you could save a life. For both men and women, new symptoms need to be paid attention to. However, for women, their response is somewhat different. And if you'll type in this title, Heart Disease in Women, Mayo Clinic, you will now be able to access information that I sought 25 years to discover. And this is a distillation. Women more commonly experience chest pressure and tightness versus stunning pain. The plaque development tends to be more diffuse and in the smaller coronary arteries. It's thought that they have coronary, is usually stated that there are coronary spasms or minor blood clots. And some women need more monitoring because they actually have what's called small vessel heart disease. I've only worked with a few of these, but it was quite helpful for those women to get to appropriate doctoring and medical oversight. But the number of vague symptoms here that can be a prelude to a heart attack, it's important that you dig a little bit and move forward with that. If you're doing massage for stress relief and relaxation, it may not be appropriate to inquire. However, if a client muses about a new symptom, keep them talking. And somewhere along the line, ask, is this truly the first time that you're experiencing this? I attended the University of Miami's Heart and Stroke Symposiums 3 years in a row. That was part of Sam's legacy to me, was a dig in. And their distillation is, this is the most important question. And if somebody has a first, they need to be medically triaged. And not everybody knows about the troponin blood test. It takes 2 or 3 hours, but you will leave the urgent care or ER with the knowledge of whether or not you have had previously or currently experiencing a heart event. You'll sleep better at night. Now, Dr. Thomas Cowan proposes that only about 50% of people who actually die do so because of a buildup of plaque as the singular cause. The other reasons he speaks to are reduced vagal supply and metabolic dysfunctions that affect the pH of the blood. We can clearly influence these. Our mantra needs to become, keep the neurovascular river running smoothly. Here's a picture of Dr. Cowan's book. So prioritizing vagal outflow from the brain is huge. It does so very much. And its scouting function with more than 160,000 neural fibers, these are actually being mapped in a project this year. They send information back to the central nervous system so that we may maintain that narrow range that we call homeostasis. People do not realize how much vagal outflow is vulnerable as a result of head, facial, whiplash injuries, falls, impacts. Let's look at the anatomy. This is the jugular foramen, and with the vagus nerve exiting along with the spinal accessory. And the spinal accessory is a cranial nerve, and the SCM and the trapezius are the only two skeletal muscles that get a cranial nerve. This is huge in terms of apportionment. And of course, their job is to protect the head. And we're going to be including the esophagus because all three are involved in the shutdown. What I didn't really get for, decades, is that unless you're able to release some of the pressure here, then the spinal accessory and recalibrating the SCM more completely you have a much more difficult time. You have to do both. And Dr. Upledger also noted that 85% of the venous return out of the brain comes through this same opening. So looking at the esophagus for a second and seeing how it blends into the pharyngeal raphe, and that has its attachment to the cranial base. This is where we begin in terms of an attachment to bone of the viscera. And look how muscular the SCM is and the trapezius. All of us have had people come into our offices with their traps or their shoulders up around their ears. That's a definite sign that the jugular foramen is being entrapped and is not, and there is a lack of vagal outflow. The relationship between the vagus and the esophagus is quite intimate because it uses the esophagus itself as a trellis or scaffolding. And once you learn how to stretch the esophagus, this also serves to increase vagal outflow. If you have not heard of Dr. Stephen Porget's polyvagal theory, please look it up. I'm just going to extract one element from it because it's so helpful to me in working with people with chronic dysfunction. Sometimes their healing is very slow. And he provided an evolutionary understanding of why. And that is, we all know about fight and flight and freeze in modern day hiding, but withdrawal and dissociation are forms of defense that lower animals use. They are part of our phylogenetic repository of neurological default positions. And I had an example of a young woman after Hurricane Irma who had probably one of the worst series of adverse events. She lost her job, her boyfriend dumped her, and she was in a serious car accident. Then Irma came, and then the aftermath. She went into her room and refused to come out. And it was quite a while before her mother got her to come see me. And I had to take a chair out to the car, actually, and being able to explain to her that this was as much a biological dial down of her nervous system as it might be a psychological implication was really helpful. I got her into that chair and began working with her neck and these structures that we're going to be speaking about, and she rebounded. So the body's central linkage. We need to comprehend that visceral organs are moored to bones. It's principally the front of the cervical spine and to the cranium itself. They are connected by overlapping ligaments. I got my first whiff of this in teaching for Upledger. I was in airports 15, 18 times a year, and I would see men walking pitch forward at 30, 40 degrees. I finally mustered the courage and walked up and asked them if they had troubles with their bladder or prostate. After 18 saying they had prostate disease, I quit asking. But I did not have this picture in my brain that I'm going to be showing you. I was on the beginning stages of learning how all this was integrated and interconnected. Here you're seeing the ligaments coming off the cupola of the lung. Our lung actually is just above the clavicle, and you can see the suspensory ligaments going to both the vertebral bodies and the transverse processes. And according to Dr. Baral, these extend up through C5. The vertebropericardial ligaments, they are moored from C4 to T4. And really crucial in our understanding is to comprehend that the heart and the diaphragm are Siamese twins. You would have to cut them apart to separate them. They begin their journey at C2 in embryology and then descend to their resting place here. These ligaments to the sternum are huge because they are one of the means by which we can increase the space within the thoracic cavity. Much less understood is the liver is actually suspended from the diaphragm itself. The falciform ligament, the coronary, and the two triangular ligaments. And of course, this is going to be part of the Oreo cookie we speak of later. Less understood as well is the liver and the gallbladder are directly on top of the inferior vena cava. And if they are at all inflamed, they occupy more space, and as a result, they will reduce the rate and flow of the venous and lymphatic return. Here we see the falciform ligament, and it's being joined with the round ligament down to the umbilicus. Nature recycles in the later stages of gestation arteries and veins into ligaments. And in a book I'm going to show you in a moment, Dr. Baral details how that same process happens from the pelvic floor upward to the umbilicus, providing suspension for the urinary bladder and reproductive organs in both genders. And here's the book. I do encourage you to add this to your library. We spoke about the esophagus and its mooring through the pharyngeal raphe. What I want to point out here is just to reemphasize, if the esophagus is suddenly pulled, it will shorten reflexively. And it has a tendency to stay that way for a very long time. In fact, because I worked with chronic cases most of my career, almost all people who came to see me had had some kind of whiplash in their background. Appreciating the esophagus in terms of its length through the thorax and its exquisite positioning between the heart and the spine, please imagine what might happen to the spine when it shortens. Now, this is the big reveal, and that is the heart itself enfolds the esophagus. The intimacy of all this is really what's so important. And if the fibers of the esophagus have shortened, it becomes a consistent resistance to the heart's expansion. And I have found this and cross-correlated it over decades, that people who suffer from chronic anxiety and panic attacks, helping this to become, for the heart and lungs to have more space, including the esophagus, really helps them to have fewer incidences. Following the same line down through the piercing of the diaphragm, here's the right cruise that wraps around the diaphragm, wraps around the esophagus, and blends with what's called the ligament of Treats, which has contractile fibers and attaches to the duodenal jejunal junction of the small intestine. Stop for a minute. The small intestine is connected all the way back up to our head. No one's ever thought about that before. And when you think about the controversy about head forward position and what creates kyphosis, these internal forces, they are much more influential in my opinion. And if you notice through following, hopefully my cursor is there, following down, this takes you into the next linked organ, which is called the mesenteric root of the small intestine. And what is most important about this is the fact that it has a diagonal quality to its attachments. You're looking at the front of the back. And here in this artist's rendition, you're seeing the ascending transverse and descending colon. So there is a commonality of connection between these. Last year, 2022, Dr. Colin Coffey was awarded what he had sought out for so many decades, and that was the elevation of the mesentery as an integrated organ. The international poobahs finally decided that he was right, and it's not just a collection of disparate parts. So from my sensibilities, and I had spoken to him vis-a-vis email before the pandemic quite a bit, this functions as both a sac and a tube, both cringing, shortening, narrowing, and of course with all the loops of the small intestine. And here we can appreciate those. All of these that I'm tracing, all of this is the small intestine. And notice the muscularity of the large intestine. Who among us has not had a case of explosive diarrhea? There is great power here. And learning to mobilize these structures is in large measure how you can facilitate better venous and lymphatic return. But let's go back to Gray's Anatomy's attachments, which suggests the mesenteric root attaches to the left transverse process at L2. Actually, I'm pointing at L1, and it goes to the sacroiliac joint. So it's on a diagonal. And I believe this is what predisposes the iliac twist. Of course, there are lots of other models for how this happens, but when you add the influence of your vertical colons, you get that much more potential torsion and compression into where most spinal surgeries happen. Now let's appreciate if there's a twist here, that's going to be communicated up the kinetic chain, and that will potentially diminish vagal outflow. Correspondingly, if you have compression in the neck, that's going to convey itself down through the spine and contribute to lumbar disc degeneration. In 1986, Dr. Baral rocked my world with a simple statement. The pressure inside the thoracic cage must be less than that of the abdominal, pelvic, and cranial cavities. There's my cursor coming back, okay? And how we are able to achieve that is by equalizing pressure differentials, in this case, between cavities themselves. This is in support of Dr. Cowan's PhD thesis, which again is a mantra, keep the neurovascular river running. The anatomy helps us, gives us an answer, because the diaphragm in its posterior attachments are made up of a loose connective tissue. So you're working from one side to the other, the front to the back, but you can vent enormous amounts of pressure as a result of doing that. And this same routing is sometimes experienced with people who have had laparoscopic surgeries with CO2 bubbles showing up in their chest, sometimes even their neck or shoulder. So adhesions and scar tissues tend to create pooling and pocketing of the venous blood and also lymphatic vessels. Mobilization of the GI tract removes a lot of these obstacles. But let's go into the actual anatomy of these anastomoses, because this is such a curious thing for nature to have created all these circles. And one day it hit me, these are like beltways around major cities. You may have to take a different path. It'll take you more time, it'll take more effort and more fuel, but you get there. So this element of the venous system really does need our help, even in healthy individuals. And of course, bringing blood off the pelvic floor. So I'm introducing the notion of inducing pressure gradients. So notice that there are 4 circles here and only 2 there. These come into what is called the splenic vein, and this crosses the midline. Looking at this relative to the kidneys, again, there's a crossing of the midline into the inferior vena cava. Space, the final frontier, as above, so below. Visceral organs are sardine packed, especially in the chest cavity. Both the lungs and the heart are double bagged. And here we see the tubes that are so important in our lives. In fact, looking at this, it suddenly occurred to me, this is why people ask for deep tissue massage, is because everything that potentially can change their internal experience of feeling more release and then relief lives directly in front of the spine. And one of the elements here, the other one is, as you mobilize these internal sacs and tubes, the tension of the outer wall lessens automatically. So you get more for less effort. And in working with Elliot in particular, I'm sure this is where this came from, was to understand that Yes, we have to get the blood to the heart and lung complex, but we also have to get the venous blood through from the heart to the lungs itself. It's a separate therapeutic objective. Here's the Oreo cookie, the wafer of the heart, the cream of the diaphragm, and the bottom wafer of the liver. Spending time applying your ministrations and what you understand about anatomy as well as technique, please do, because this is where the action is happening most importantly. Now, where is that pesky tricuspid valve? Between ribs 5 and 6. If you feel density on this side of the chest, you may be working with someone who has ventricular hypertrophy or an enlargement. But working across and with these costosternal and chondral joints and increasing the pliability to the anterior chest is crucial. Yes, Elliot is still alive, working with his wife in their fruit and vegetable stand. Liver and gallbladder also sit on top of the cisternae chyli, and then the thoracic duct as it snakes its way up the right side and then crossing to the left, because it carries raw materials for nourishing blood as well. Now we have yet another possibility for a new organ, and we're calling it the interstitium. It's always been there. The spaces between cells, and it contains fluid that offers us protection during impact injuries. These flow into the lymphatic system. Something that people don't conceive of is that congestion, generalized congestion, can also affect joint integrity. So one of the holy grails in bodywork is to stimulate micro and macro circulation simultaneously. We all learned about the valves in the arms and legs that help blood from backflowing, given the omnipresent force of gravity. But these valves stop at, I have to move my thing here, at this bifurcation at L4-5. And from here on up, it's principally breathing, movement, and exercise that moves the blood back to the heart. So this is the level of the diaphragm. In 1984, I had a female client come to me stating that her inferior vena cava didn't work. And I went, okay, I'll bite. How does your blood get back to your heart? And she said, through the azygos and the hemiazygos veins. And had to go home and hit the books. There was no Google in those days. But it's really quite remarkable that nature has created this entire collateral system. And one of the takeaways from tonight, please note that above the diaphragm, the blood in the chest wall from the left side has to move to the right and then up to the superior vena cava. This venous architecture drains the body wall as well as the arms and legs. Many of us believe that the liver filters all the blood, and that's simply not accurate. The portal vein system is dedicated to draining the GI system and the reproductive organs. And again, we have a clearer picture of this crossing of the midline and how this joins into the splenic vein. Again, engorged blood vessels can also disrupt normal tracking of joints. And we're back to our original thesis: viscera affect the joints, and then the soft tissues must protect them. And again, okay, this is another motion MRI that allows you to see the movement that the diaphragm creates, naturally inducing pressure differentials throughout the abdominal pelvic cavity. But now you have a new idea, and that is that we can help the blood find its way back to the heart and lungs, both above and below the diaphragm. A new idea with big results. Okay, I got to get rid of this pesky thing. I apologize. So the summary: save a life, learn more about women's hearts. I can't see the next one. I apologize. Okay, folks. Save a life, learn more about women's hearts. Come study with me and learn about the body's central linkage and how this can help you to help your clients even more. Do experiment with inducing pressure differentials. None of this is rocket science. Please stimulate the Oreo cookie's tricuspid valve. The inside out paradigm is a novel way of conceiving of anatomical and physiologic relationships. It is a whole new set of ABCs. Here's a listing of the courses that I teach. All have been nationally approved with the exception of this one, which I'm still working on. Please consider bringing together a group of practitioners so that I might come and teach with you. I am 71 years old and nobody knows how long they have left. I'd like to share the fruits of all these years with as many people as possible. And thanks to Danielle, she's moved us up in the queue, and we're going to be coming back on March 19th. And here is my contact information, and follow me on my website, such as it is. Write me or call me. Yes, Danielle.
Well, thank you. So much information. I don't even know where to begin. I'm hoping that folks will, we have a chat from Tanya. If you have not studied with Dale, definitely do it while you can. He is an incredible teacher. So a recommendation from one of our listeners. When you, a slide back or two, you mentioned stimulating the Oreo cookie.
Mm-hmm.
How do you do that? I mean, how is that done on a massage table?
Well, let me go ahead and get back to a better.
Okay.
Okay. So basically, your hands are in front and back of the body. And then you can also learn techniques called recoil that send a wave that allow those sacs to loosen. As I mentioned, the heart is double bagged, as are the lungs, and getting them to slide and glide is a big part of it. So working the front and the back simultaneously is most commonly how that's done. And that's true of stimulating pressure differentials to induce, to move the blood over from the left to the right side and from the pelvic floor upward.
All right. Well, I am at a loss, not being a therapist, so I'm hoping if therapists have questions about this, they'll jump in. Now, Dale, would you normally go to this area of the body because someone has said they have tightness in their chest or they have a history of heart issues? Why would you necessarily go
Yes, and yes. What I've just outlined is what everybody needs. People who are coming back or are challenged with health problems, they have those challenges, and all of them can be improved by better circulation. And first of all, most people don't really have never seen some of the more intricate elements of the venous system. And remember us talking before, you've had 8 or 10 shows on lymphatic drainage. It's a hot topic, and there's a good reason for that. But to be able to hold the whole and working with people, but when someone comes in, they may have, a particular area of strain or stress. But most of the people who come to me have real troubles and autoimmune diseases. I've worked with long COVID quite a bit. And so far, I've been able to help most of them a fair amount. So there's always something new, and people come in with diseases and troubles that I've never heard of, and I have to run to keep up.
Well, that's a good thing. It's good
Yes, it is.
information. Let's see. Stephanie is asking, do you have a course that would help with lymphedema patients?
Probably the visceral course is where I go into more of the elements, but you probably want, I took the Kloss lymphedema training last year, and I would recommend them. It's a very well put together. Our instructor was superb. Um, if you actually want to work with lymphedema patients, then you need those skills. Will the ones that I teach you help as well? Yes, they will. Because as I said in one of the slides, being able to access and facilitate the movement of both uh, deep and superficial drainage is huge, as well as micro and macro. Both are needed. And I've gotten dumb lucky. And I only know that it's improved that much because patients come back or clients come back and say, I can't believe how much better I'm feeling. And I've only seen you 3 times. I mean, it used to take me years to unravel the knot using more biomechanical ways. I was initially trained by an ex-rolfer. And as I said, I taught the muscle energy course. But until I really began understanding the fluidity of everything and how to enhance and jumpstart that fluidity, that's when the magic started happening.
Very good. Leanne is asking, for new folks, how about simple abdominal massage towards the end of the massage?
Utilize whatever you've been taught and you believe is safe. There is hardly any reason to be afraid of the abdomen or the thoracic cavity or reaching in and literally working with the brain. All are feasible and possible and safe.
And Tanya mentions his central linkage course would facilitate your ability for venous and lymphatic return.
I mean, I try and touch on every aspect that is truly important, but in each course, I'm adding additional skill sets and understandings. Is there some overlap between the courses? Yes, there is. But most people need the review to lock it in.
And now I'd like to ask a question. I was with someone over the weekend, and they had a procedure on their heart, maybe 8 months ago, which she called a roto-rooter process.
Okay.
And I've been with her twice where all of a sudden her leg just swells up.
Well, that's what happens is if the blood can't get back to the heart, being processed, renourished, and sent back out, you're going to get swelling into the lower extremities. And sometimes it can be also the liver or the gallbladder that can create that, or there can be obstructions within the venous system. Peripheral artery disease is an example of that. You have to kind of look through all the different possibilities, but the most common is right at this Oreo cookie, where the heart sits on top of the diaphragm and the liver is directly beneath it. If you will spend more time working with this area in any way that makes sense to you, you will indirectly or directly affect positively your client's quality of life. And that's what we're in. We're in the quality of life business.
That's so true, and thankfully so. I haven't seen any other chats come in. There's still time for, let's see, where to begin studying this if anatomy has gotten quite weak. Should say anatomy knowledge.
Trust me.
What's that?
I said, trust me, in 2 days, I will help you make leaps and bounds. None of this is rocket science. So often people can't keep their understanding between figure foreground, and they get caught up in the names, they get caught up in all the pieces of assessment that supposedly you should do before you do anything. And none of that is actually true. It's also very useful and I will teach you assessment skills as well. But actually allowing your hands to learn again is how you learn anatomy. Trusting your hands. I didn't come up with these as ideas. My hands showed me what to do or kind of nudged me. And then clients said, gosh, I felt so much better. What'd you do? And I went, oh, I'll have to kind of think about that. And if you logic it out and reason it through and go back, and I mean, Dr. Baral was a stickler for anatomy. And he and his first protege, Frank Lowen, is probably the best anatomical artist I think I've ever seen. And for those of you who are on the West Coast, please seek him out. He's one of the best out there.
And
But
what is his name again?
Frank Lowen, Lowen.
All right.
He's an anatomical artist as well as a practitioner. And, you know, we were kind of like the Bobbsey twins for a while.
Very cute. And a powerful knowledge team there. Dale, would you just scroll down to your contact information again? I will include it in tomorrow's follow-up email, which will include Dale's contact information, a link to this recording, and he has included 2 articles that he has written that will be in the handout tomorrow. And let's see, I'd like to mention our upcoming Edu Talks, December 12th, next week. So this is a quick turnaround. We have Elizabeth Clark presenting on therapeutic heat benefits for clients with arthritis. Then we take a break over the holidays and return January 16th with the EduTalk Diabetes series, which is a new series that was launched in May 2023. And we have Dorothea Atkins presenting self-massage, a new self-management approach for diabetes. On January 23rd, we have Eric Brown presenting on 60 clients in 60 days. Eric also presented a 2023 EduTalk on the fainting phenomena with chair massage, which is in the archive library, the EduTalk archive library on biotone.com. So please check that. And the end of January, the 30th, we have Dr. Tiffany Ryan presenting trauma-informed bodywork, knowledge needed to do no harm. We've got a fabulous lineup for both the EduTalk series and the EduTalk Diabetes series for 2024. So please join us. If you do not see the follow-up email tomorrow in your in-basket, please check the junk or spam folder. Often it ends up in there. And in closing, Dale, is there anything you would like to say in wrapping up?
I would like to make the request, if you have any clients that have congestive heart failure and they're healthy enough to travel, please encourage them to come see me and come with them, and you'll learn a lot.
All right. And that is in the Palm Beach area of Florida.
West Palm Beach, Lake Worth Beach is just south of West Palm Beach.
Great. Well, thank you so much. And thank you, everyone, for joining us tonight and listening and learning with us and Dale. And we hope to see you again. Take care through the holidays. Be well, be safe. And as I say that, I'm thinking that the EduTalk Diabetes series had some great presentations on don't let diabetes define your holiday celebrations. So that's a good one to watch. And that can be found on EASE website, which is EASE, EASE -zinc, ZINC.com. And thank you so much, everyone. Be safe, be well. Merry Christmas, Happy Hanukkah, Happy New Year. And we'll see you in next week, hopefully, for Elizabeth Clark's therapeutic key benefits for clients with arthritis. Thank you so much, Dale.
Okay, thank you,
And
Danielle.
let's see, one last message. Thank you for a great presentation. Take care,
God bless.
everyone.
God bless and Merry Christmas.
Thank you. Take care.